But anyway, think about this for a moment. What is one of the most used muscles in your body? Now, as a newborn baby, it's the first muscle you use to announce your arrival in the world. Throughout your life, you use it to let others know how you feel, and it's one of the most important muscles we use for communication. Now, this is, of course, your voice, and today we speak to speech therapy students who have been tasked with spreading awareness on vocal health, about the implication of vocal injury to the everyday man and woman who may not know that they are, in fact, at risk of voice damage. And joining us this morning, speech therapist Laura Russell and speech therapy honours students Megan Clark and Talinia Govender. Good morning and welcome to the show.
Good morning. Thank you for having us.
Now let's talk a bit about what you do. Voice pathology. What exactly does that entail, that discipline?
Okay, well, we are professionals that are trained in assessing and treating, excuse me, all manner of voice disorders, for instance, voice problems. As well as that, we work with adults and children who have problems perhaps acquiring language, who've had problems with language maybe after a head injury or a stroke, stuttering, difficulties pronouncing particular sounds, and we also work with feeding and swallowing, which a lot of people don't know.
Yeah.
So it's a very broad profession.
Yeah. Now, Talinia, we hear it a lot in the news. Oh, this singer has nodules in their voices, their career might be over, and then we seem to think that it's only they, or those kind of people that are at risk. And is that so, though?
No, not at all. In fact, singers are better off than the rest of us because they have formal training and know how to take care of their voices.
Oh.
Yeah, it's every other person that's at risk, like mothers with young children, teachers, call center agents, girls that are chattering, and even gaichis. People that may work in environments that are dry and dusty, like construction and factory workers, are also at risk.
Yeah.
And
sports fans.
Yes, sports fanatics that are screaming at sports matches and even at concerts like the Justin Bieber tonight.
Are you going to be there? Is that why you say that?
No.
I'll be there.
I mean, there was someone standing there, actually one of my colleagues here, Ashley, I'm going to name and shame him right now, at the Bon Jovi concert last night, and every second song, he was like, he's screaming his lungs out, so something like that could really...
We'll give him some tips later on.
Okay, all right. But let's talk about the possible injuries that you could incur.
Well, the most common
voice.
injury would be a vocal nodule.
Yeah.
And vocal nodules can be treated easily with speech therapy. However, if they do get too large, then surgery might be necessary. And things to look out for if you are concerned would be hoarseness, or if your voice feels scratchy,
yeah,
or dry, or like you've got something stuck in your throat. Also, pain could radiate from the throat to the one side of the ear. And if you're a singer, then you might not be able to reach the high notes that you're used to reaching.
Yeah.
So if you are concerned, then it's best to deal with it soon.
What are some of the long-term injuries that could happen? I mean, if you don't take care of it, let's say you do experience some of the symptoms and then you don't immediately consult someone who knows about it, what could happen in the long term?
Well, basically, because your vocal cords are so tiny,
yeah,
and they're covered by a thin, delicate membrane, and they open and close for up to 400 times a second when you're speaking. So you can imagine how much of work they do.
Yeah.
So you could have, as Megan said, vocal nodules and
surgical.
And obviously, I mean, if you're a singer, that's
procedure.
something you don't want, because I mean, it affects the way your voice sounds at the end of the day. If you're a voiceover artist, you might not have the same quality of tone when you speak, right?
Definitely.
Yes, exactly.
Yeah, we've seen a lot of people in our voice clinics who have lost their jobs or at risk of losing their work.
Wow.
Because they're no longer able to talk, particularly people like presenters and call center agents and singers who aren't able to perform. And even just for those of us who don't use our voice to perform, we use our voices to socialize and connect with people all the time. So you can imagine, we've all experienced the frustration of temporary periods of voice loss. Imagine that long term. It's a serious consequence.
So if I were to go to a speech therapist to try and find out whether my voice is healthy or not, how would a basic, let's say, examination go?
Well, a basic speech language therapy consultation will entail a detailed case history to find out more about how you're using your voice and maybe what factors are contributing to your voice problem, like maybe your diet, because remember, things like heartburn are common causes of voice problems.
Yes.
So they may ask you to do some things with your voice to get a better idea of your vocal quality. So can you take a deep breath in for me and say, ah?
Oh, am I supposed to do this now?
Yes.
Oh, okay, okay. This
So
is me taking a vocal exam.
So can you take a deep breath in and say ah for as long as possible on your normal pitch and loudness?
Okay.
Excellent.
Okay, yeah.
Now to get a better idea of your vocal cord vibration.
Yeah.
So can you take a deep breath in for me and say zzz for as long as possible.
That could be one of those long ones again.
Okay, your vocal folds are fine.
Okay.
But if you're a singer, then they may ask you to sing from low to high note,
Okay.
like scaling from R, to
well,
get a better idea of your pitch range.
I'm a shower singer, like trying to break out like that. So maybe
Okay.
Shower
That's fine.
singers are also at risk.
So you something like oh.
Yes, exactly. But basically, the examination is very non-invasive, and we use our ears as our tool.
Yeah.
So it's not scary at all. And so we get an idea of what your voice is like and what factors are contributing to it and what the problem is, and then we can treat it from there. Like maybe give you tips on how not to strain your voice.
Yes.
But it's also important to remember that if you are worried about your voice, you should go and see an ear, nose, and throat specialist first, and they can refer you to a speech language therapist.
Okay, fantastic. So what would you say of my vocal health right now? Is it intact? Am I okay?
I think you sound
Yeah, I think you sound
Okay, yes. You're giving me a nervous little nod there for a moment there. Ladies, thank you very much for coming in and educating us on vocal health. I think I'll have to go and see that ear, nose, and throat specialist just to make sure that everything is in check. Of course, if you want to find out more, check out our website, expressoshow.com. We'll have all those details for you about how you can contact them as well. We'll be back with lots more on Expresso right after these.